Okay, good morning. It's a real privilege to be here with you today and to present my very, very, very passionate topic, breastfeeding. Now, I could talk to you about breastfeeding for 10 days, never mind 10 minutes. So you can imagine how difficult this was for me. I am going to be a little bit controversial because I want you to think about this and I want you to discuss this. So in the concept of the first antenatal visit, or even before that, how many of you actually get families, couples coming to you saying they want to think about starting to conceive a child? And I don't imagine there are huge numbers, but there may be a few. When that woman and her partner come in, we don't straight away ask whether she wants to conceive that baby naturally or whether she wants IVF. We assume they're going to try the fun way first, and then they're going to go for the medical intervention later if need be. Okay? So why then do we ask women whether they're going to breastfeed or bottle feed? Okay? So very, very controversial. Is formula feeding worse than smoking? They both cause cancer. They both cause heart conditions. They both cause respiratory conditions. On top of that, breastfeeding is a huge immune protection. It's brain development, it's nerve development, it's bonding, it's protection from the mother. Okay? And yet so easily we go often, well, we'll just give a formula top-up, maybe because the baby's not growing or, because there's an issue. Now, I'm not going to say for a second that that's incorrect or that we shouldn't be doing that. If I'm asked by women, the difference between formula and breastfeeding, I'll often compare it between a mansion and a dog kennel. Okay? And at the end of the day, if it's pouring with rain and freezing cold and there isn't a mansion available, would I be tempted to crawl into a dog kennel? Yeah, most probably, okay? As long as there's not a big scary dog in it at the time. Breastfeeding is 10% about nutrition. The other 90% of breastfeeding is development and protection and immunity. Mum's milk is specifically developed for her individual baby at that individual point in time. Now, there's a discussion about cows having 4 stomachs. For those of you who have done animal anatomy as well as human, you'll know that that's not quite specifically scientifically correct. It does actually have 4 compartments of one stomach. They also have a really small brain, and they only feed twice a day. So their milk is designed to support small brain development, big body growth, and keep that baby very full for a lot longer, okay? It's just a thought, isn't it, hey? So what I'd like to do now is just move very, very briefly on to just giving you some really practical, helpful information that perhaps you can help to support a woman with breastfeeding, and all of the time, at the same time, the pathway is on the other screen for contacts and for support services available throughout Auckland and Counties Manukau. Okay. So the first thing that I'd like to really strongly encourage all practices is to actually purchase a copy of Medications and Mother's Milk book. This is written by Thomas Hale in the States. He is absolutely the world-renowned expert on medications transmitting to mother's milk. It's hugely expensive at $60 US plus $12 postage anywhere in the world. And I've got the 2014 version, but the 2017 is just on its way out now. There's also a website called LactMed, and you can just do a Google search for LactMed. You do not need to remember that big long web address. That will give you really useful, helpful clinical and study information around medications. For most medications, As a rough guide, if it's been safe for that mother during pregnancy, it is most likely going to still be safe for that mother during breastfeeding. Okay. And then just to give you a little bit of helpful hints and tips in terms of the passing into the milk, if the molecular weight of the drug is greater than 500, it is very, very unlikely to pass through into the breast milk compartment. And then you also want to think about the half-life for that medication. We know it takes 5 half-lives of anything to get that drug to a minimal level in the body. So obviously the shorter the half-life, the quicker that is going to transmit out of the milk and the baby be safe to feed. For the most part, the only things that really people get excited about are things like radioactive iodine, some of the chemotherapy medications, and lithium. That's about the only ones that we would really absolutely say, try and find an alternative. Okay. For most of the rest of them, there would absolutely be a case that medication plus mother's milk is much, much safer and better for both mother and child than formula feeding. Okay. So what about slow weight gains? That's one of the things in primary care most often women would come along to you with. What kind of things do we want to think about? Well, we absolutely want to think about how long the baby feeds, how often, whether the mother offers one side or two. I really want you to think about that latch. Is there a problem with the nipple? Is there pain? Is there whatever? Does baby sleep overnight? What's the general behaviour like? What's that general picture? Do they look like Saggy Baggy the elephant in their skin? You know, do they really look like they're struggling? What's their output like? What kind of things could we consider? One of the things that we know is that many practices do not use the WHO growth charts. The World Health Organization spent a very long time and did a lot of research on these. They are based on breastfeeding babies. We know that throughout the world, babies follow the same growth curve. And for a breastfeeding baby, it tends to go up quite sharply in the beginning and then start to taper off around about that 3 months. If you're using the wrong growth chart and they get to the 3-month mark, it may well look like their growth is starting to falter because formula-fed babies don't do that. Some of the easy things that you can think about, obviously referring to someone who can give some advice and help, encouraging skin-to-skin contact between mum and baby, using breast compressions, and it's literally mum is going to hold the breast up by the ribs in whatever position way round she wants, and as the baby sucks, she is going to squeeze gently like you would squeeze a sponge. When the baby stops sucking, she stops squeezing, and then she keeps repeating that while the baby feeds. Is the baby actually feeding, is the other thing. Because if there's not swallowing and deep jaw movement, it's nibbling and having a snooze. Okay. Now, controversially again, one thing that I would like you to keep in the back of your mind if you've tried everything else is the research is quite inconclusive around progesterone contraceptions, but for some women, and it's a very small minority, we know that they are super sensitive to progesterone and that it can significantly impact their milk. It seems to be a very, very, very small minority, but if she's giving a clear history of breastfeeding fine to 6 weeks and starting some sort of contraception and all of a sudden now seriously struggling, it's something perhaps we can amend. Okay, contraception is still really important, but there are lots of options. It doesn't necessarily have to contain progesterone. Now, midwives won't often prescribe domperidone, so often you'll get a letter or a woman coming along to you saying, my midwife has recommended I see you for medication to increase my milk. Rest assured that is absolutely the very last resort. Okay? The most important thing is frequent, effective milk removal. If, however, you or the midwife or the well child or the LC, someone has gone through all of that, then there are some prescription guidelines on breastfeeding inc.ca that might be helpful, but typically 10 milligrams 3 times a day, and really suggest at least 6 weeks script, and just being aware of the long QT syndrome that it can affect, and for some women it also affects liver function. Mastitis or engorgement, blocked duct, which is it? And how do we treat it? The only time I really suggest heat is if there is a genuine blocked duct, so not a lot of redness and a big hard lump. Everything else that is likely to be swelling, you want to use cold. Okay. The preferred antibiotic is Fluclox. Okay, and if that's not possible for allergy reasons, then trimethoprim. Okay, and again, please feel free to refer. Tongue tie seems to be very, very topical. The message I want you to take home from that is that not all evident frenulums need to be cut, and not all tongue ties are evident. Function is much more important than appearance. They need a proper clinical assessment of breastfeeding and function of the tongue, as opposed to anything else. And then just a little bit about the services available, and they are in the Auckland regional pathways there. But Counties has 0800 B4Baby phone number available to all women from 8 in the morning to 8 in the afternoon, Monday through Saturday. Between B4Baby and Torito Ora and Plunkett, there are 4 LCs free and available in Counties Manukau, as well as Kayafina to give antenatal education and postnatal support. We've got La Leche League, we've got umpteen different sources, so do seek help and support. And my phone number is also on there, and I'm very, very open to a phone call while the woman is in the consulting room to discuss something. That's not a problem. Thank you very much.